Watch this video before you have a breast biopsy. Breast biopsy results are not so black and white. Let me explain. Hi, I'm Dr. Robin Roth, aka the Booby Docs. I am a breast radiologist, which means that I'm the doctor who performs breast biopsies and also gives biopsy results. And when we talk about biopsy results, we typically think of benign versus malignant or cancer. And the good news is that 80% of biopsy results will be benign. And typical benign pathologies include fibroadenoma, cysts, lymph nodes, fat necrosis, and PASH, or pseudoangiomatous stromal hyperplasia, which is what I recently had. Now, another 20% of breast biopsies will unfortunately be cancer. Breast biopsies will tell us not only if it's breast cancer, but what type it is, whether it's DCIS or ductal carcinoma in situ, which is stage 0 breast cancer. I talked about this in detail in an earlier post, or invasive breast cancer, such as invasive ductal or invasive lobular cancer. It will also tell us the grade and hormone receptors if present, which will help guide treatment and outcomes. But there is a third category that we have not discussed yet, but we must. And this is the gray zone. About 5 to 10% of biopsy results fall in this gray zone, where it's not cancer, but it's not entirely benign. And these include high-risk lesions such as atypical ductal hyperplasia, lobular carcinoma in situ, flat epithelial atypia, radial scar sometimes falls in this category, as well as papilloma. And these are not cancer, but often they are taken out or surgically excised to ensure that there is no underlying breast cancer associated with it. There is a slight risk of upgrading to cancer at the time of surgical biopsy. Also, some of these lesions will increase your risk of developing breast cancer in both breasts, so you might consider adding a breast MRI onto your annual mammogram. Also, within this gray zone category falls discordant pathology, which are when the biopsy results are benign, but the imaging appearance is so suspicious that it's not entirely explained by the biopsy results, so we recommend a surgical excision, which is what I ended up having myself, and it was ultimately benign. I hope this was helpful. Have you ever had a breast biopsy? Let me know in the comments. As always, follow the Booby Docs for more of the breast information.